Hi, Dr. Chiungos here today. I wanted to take a moment and talk to you about probably one of the most important issues in chiropractic, which is injuries related to lifting. So I'm going to stand up now and I want to show you some of the misconceptions and some of the things that I've learned over 20 years as to how to properly lift. Many folks who have been in a back class at work safety have learned bend your knees. It's always important to bend your knees, okay? But I wanted to dispel that myth today. Most of this information you'll find on functional movement systems, FMS, as far as proper motions when lifting. Your power lifters know this, your kettlebell practitioners know this, and I want you to know this too, okay? Very important. When we watch someone lift, the proper mechanics of lifting, what we don't want to see is the back bending. The first mistake people make, they reach towards the item with their upper back. That's just a no-no. It's not done. Okay? Head up, chest up. The next misconception is bend your knees when you lift. You bend your knees when you lift. That's how you lift. No. We don't want the knee passing through and in front of our toes. It puts too much strain on the front of our legs. Oftentimes people will complain of knee problems. I know physical therapists deal with this a lot, balancing the muscles, and they'll appreciate what I have to say. So what's the proper way to do it? Very, very simple. Head up, chest up. Think about your butt, not your legs. When your head up and your chest up, push that back, push that buttocks back, and start to come this way. Okay? So just hands in here, push to the back wall. If you notice my head up, my chest up, my back hasn't bent. White and Punjabi talked about the injuries that would lead to intervertebral disc injuries or herniated disc, and they were simple as this. A patient bent over, twisted, and lifting. Okay? So how do we avoid that? Chest up, head up. Feel free to move around your object. I work with a lot of people who move in retail. Oftentimes they have heavy boxes from the ground. And remember this, the lower we go or the higher we go, the more risk of injury. So if they're lifting cases off a pallet, oftentimes I'll have them lift one edge of the box and bring that up towards them. And then pushing through to the hips. So it's always about the hips going towards the back wall and then forcing the hips to the front wall. Okay? Now, two things I want to mention. If you find you're gritting your teeth, chances are the item you're lifting is too heavy. Stop. Injuries occur in the heat of the moment. If it's too hefty, get a person to help you lift. I'm going to sit back down. There's a lot of articles online. Once again, I do recommend the functional movement system is a great source of proper lifting and proper mechanics. This is Dr. Chiungos. I hope you found this helpful. You can look me up on my website or call me for a consultation if you think you have spinal related problems due to improper lifting. Thank you.